Really thrilled to be here today with our great friends and partners at Shatterproof to provide a briefing on the services that Shatterproof offers to support employers committed to addressing addiction in the workplace and creating recovery-ready workplaces where all of their employees can thrive. I'm so pleased to have the team from Shatterproof on today's call, including my great friend Kirsten, who is going to take it from here. So Kirsten, over to you.
Thank you. And we're so thrilled to be here. So some of you may have joined us last month when we were part of Recovery in the Workplace webinar that we hosted with our friends at Hazelton and the Health Action Alliance. And we're just happy to have this opportunity to share some, resources that employees and employers should know about as they navigate substance use disorder. So thanks for having us. I'm here with my great colleagues at Shatterproof, Leslie Litsky, Vanessa, Audrey, and so we'll just start to share some more information about Shatterproof and the resources that we have available for you as you think about substance use disorder and how it may be impacting your employees and your customers. So just an overview about Shatterproof. We are a national nonprofit that's focused on reversing the addiction crisis in our country. We like to say that the proof in Shatterproof is that everything that we offer is evidence and science-based. And we believe that no one should struggle from or die from substance use disorder, which is a treatable chronic illness. And so we are here to be your trusted guide through the complexities of substance use disorder. So just to give you a snapshot, when we talk about substance use disorder, we're talking about drugs and alcohol. These are the substances that are really impacting our society today and the recurrent use of those. So, when we at Shatterproof really focus on these and on substances only, and we know that this is a coexisting condition with mental health challenges as well. Next slide. 46 million people right now are struggling with substance use disorder, 12 years old and older. So, and that number is up 6 million from the previous year. So this is a growing issue in this country, fast growing. We also know that the overdose rate is growing at the fastest rates ever. It jumped from just over 107,000 people to 112,000 people in this last year. So we're in an urgent crisis that really needs to be addressed. And it can't just be addressed at home. It needs to be addressed throughout communities. And employers play such an important role in helping their employees and their customers and their families really think about how they can be helped as if they're struggling. And it knows no boundaries. There's a lot of stereotypes and stigma that's out there. A lot of what we see in the media portrayed often are images of people who may be homeless or, struggling on the streets. And that's not the case. This really is a disease that knows no boundaries. And it can impact family members, coworkers, neighbors, your loved ones. And it's so important that we remember that just your next door neighbor could really be struggling, or your coworker in the cubicle next to you, or on that Zoom that you're talking to. And we know that there's also health inequities that are happening. And this is because there's, less access to healthcare, that there's also, just systematic challenges that have happened. And so we at Shatterproof have been paying a lot of attention to this. And in fact, we have a new campaign that's going to be launching tomorrow with the Ad Council to address this and to help those in the Black and Hispanic communities to start their recovery journey. So the impact on companies, as I mentioned, there's 46 million people struggling with substance use disorder. So we can assume that about 152 million Americans know somebody with substance use disorder. So it's likely that just within your own workplace, you've got people who may be struggling. You can go to the next slide. Or maybe in recovery and working hard to remain sober every day. They may have a loved one that's facing substance use disorder and struggling. And they may be managing the burden of supporting a loved one with substance use or recovery. Because the stigma is so pervasive, a lot of people just don't talk about this and don't feel like it's safe to talk about because of the judgment, because of the shame. And so there are things that you can be doing to help break that down. And we at Shatterproof want to be that guide for you and for others to help them along the way. So we offer a lot of resources and training. We know that this is a treatable disease. Believe it or not, 75% of this country does not actually even see substance use disorder as a disease. But it is a treatable chronic disease. And so there are resources that we've made available for people, for employers, for families to make sure that they have what they need. And so through the work that we do, you as an employer can really help people learn about addiction so they understand what it is. They understand that it is a treatable disease. You can educate your employees on how to stay safe. There are harm reduction. We know the dangers of fentanyl today are pervasive, and we want to make sure that you understand that and the things that you can be doing to prevent anything around the use of fentanyl and understand those dangers. We also are offering proven resources for employees who need help. And you'll hear more about our Just 5 program as well as our Treatment Atlas platform. And then, there's steps that you can be taking to really just change the culture of your environment, to be a recovery-ready workplace, to be that supportive environment for those who may be in recovery. And so we want to be your trusted guide through that. So normalizing substance use disorder at work is really what we want to be doing, right? We want to help you make the environment within your workplace, understanding that if 1 in 3 people are impacted by substance use disorder, whether it's themselves or a loved one, that their place of work is a trusted, caring environment, and that's focused on well-being. And so there are ways in which you can, work with Shatterproof, to hold employee town halls. We do this with many of our partners, where we have courageous conversations and town halls that cover a variety of aspects. In fact, I just did one with one of our partners last week, where some of their employees that were in recovery shared their recovery stories and tips and tools on how their fellow employees could be helpful within the workplace of supporting recovery. We provide training for employees on how to prevent, identify, and address a substance use disorder. We also have trainings on stigmatizing language and how to eliminate that. We create empathetic, compassionate workplaces from the top down, and we tell personal stories. That's what we're really great at. Our whole stigma campaign is about people sharing their personal stories that are real and can really get people thinking differently. And then we help employees get the help they need without judgment. We have great resources on finding that, treatment, and we help HR and benefits leaders access quality treatment services as well. So we do have a website at shatterproof.org/employee resources, where we have those free education tools. I'm going to turn it over to my colleague, Leslie, who's going to share a bit about our Just 5 program and what that's all about.
Sure, Audrey, you can leave the slides up for just a little bit till I get to the demo spot. Thank you. So Just 5 is an addiction education program that Shatterproof released in 2019. And we are really, again, following with the themes that Kirsten was presenting there. Educating employees about addiction is critical for everyone's health. And we created what is really a simple online self-paced program. We've also created it for, it's online for people to use. We've also created a version that can be used within learning management systems at companies. And you can see on the lower left a logo garden of some of the employers and companies that have been working with us. Excuse me. In the program, we've got 9 core lessons, which are meant to really raise the bar from the floor up maybe 1.5 inches of just basic knowledge on these subjects so that people can have a conversation. They can have a conversation without stigmatizing language. You can go to the next slide. Because what we know again is that 70% of adults with a substance use disorder are employed. So they're in your workplace, they're working with you, they're beside you, and all of these people certainly need our support. Next slide. If you are looking at moving your company toward being a workplace recovery ready program, there's many different aspects to that. Many different states or local organizations have those sort of workplace recovery ready certifications, and Shatterproof can really work with you to get to that point where you, again, have the conversation, you provide resources. I want to show you just a product that slides right into that requirement to educate your employees and to educate your supervisors on all levels around substance use disorder, again, to reduce the stigma and the risk of the disease in your organization. Next slide. And now it's time to demonstrate. Give me a second. I'm just going to take turns from Audrey here. Just Five, as I've mentioned, is an online platform. We deliver it to a company by giving them a custom URL. And when I say that, here is an example of one from QED Investors, a fintech company in the DC area. So each company gets their own landing page with the same core content. We work with you to customize both the page and the messaging, why you are trying to bring your employees toward looking at and having the conversation around addiction. We have embedded surveys we can use or not to track engagement, and we also provide data to our partners who use the education on their staff's engagement. We do not require registration. We do not have any tracking of the employees, so there is no need to be familiar or to load employees. We simply hand out a URL and you make it available through whatever means that you distribute your other health education to your employees. The core lessons are bundled into 3 areas, the first being what addiction is and who's at risk. Each of these lessons is meant to, again, raise the base of what people know and understand about addiction, needing to know such areas as who is at risk, environment that you were raised in, the age that you first use, and your basic genetics increase your risk for addiction. The next bundle here is all about how you can make a difference. And instead of really focusing on, here's what residential treatment is, here's what outpatient treatment is, we really want people to just have more of a general knowledge, such as in, let me pop one lesson open for you, how you can help. How you can help someone is really about encouraging them to get to medical attention, to learn, to support them, to support yourself if you are that family member responsible and caring and worried about them. Each lesson has a marquee video that follows that topic area. We then offer more interactive. We worked with a team of both web designers and learning instructional designers to build the content so that people can learn in many different ways, and they again can interact very quickly with it. That's why it's called Just Five, because it takes only about 5 minutes to kind of get down a lesson and learn the main points that are here. Each of the lessons also includes resources. We launched in 2019. We had envisioned being on work boards and breakout rooms. Didn't always happen exactly that way, but many partners do use the education and might grab a handout and send it out if they're promoting an idea or something that's happening in a particular month. The education itself also has a lot of review and repetition because adults stubbornly learn. And if we want people to get educated, we'll need to get them accustomed to the content and how we are feeding it to them. And Kirsten was talking about stigma. We have a dedicated lesson on the importance of how words matter. Again, a video sort of going through the impact of using stigmatizing language and how hurtful it can be. We talk about the difference here between the person with the substance use disorder and how they talk about themselves versus the healthcare professional or others and how they should be doing the speaking. And again, everything in the training is very visual and meant to just really sort of grab you with what you're learning to do it quickly. I'll scroll back to the main page. So again, we have 3 bundles. The last right now is ways to protect yourself and others through opioids. We do always consider new topic areas to add in here or other substances to focus on. We're looking at potentially bringing in a lesson on alcohol or a lesson on marijuana. And again, the idea we've always been adding. This past year, we went through a review with Kaiser Permanente of the content from a DEI perspective and did full updates on all the education that's here. The last part I want to share is that we have also done customized lessons for partners. We have a dedicated lesson for supervisors because, again, there's a lot of, if you were to Google as a supervisor, I'm worried about an employee, what should I do? You're going to end up on a lot of HR pages. You're going to end up on a lot of pages that are really more about the legal aspect of what's going on versus the where do I start? How do I start a conversation? How do I try and work slowly and bring in my formal employer processes? So again, this is really a best practice kind of training to gently move people toward how they could help. We also worked on a lesson with Head Start and Georgetown on working with Indigenous communities and addiction. So again, that was very much a custom specialized lesson done at the request of a partner that worked with us. Audrey, if you want to put back on the main PowerPoint. I will stop sharing. We also went through a process from our initial rollout, and we have data at which we have both published and presented at the American Public Health Association conference on showing the impact of the training, and that, again, raising the bar, the floor 1.5 inches up, just the gentlest of putting good, simple to follow education in front of your staff will change their attitudes, awareness, and allow them to behave in a different and more positive manner toward those with a substance use disorder. For example, in helping, I know how to help if I suspect someone is addicted to drugs or alcohol. In pre-surveys, the answers on a scale of 1 to 5 were at 39%, and then we moved up in that post-survey to 82% agreeing with that statement. So again, we're really excited about the product. We've got it in over 50 companies or community-based organizations, and partner organizations are what people stay and read. There's so much on the web. So this just makes it easier for people to absorb. And they trust you as their employer. So then they trust sort of what you give them to read. So that's my part on the program. Again, we'll do questions as we get through to the end.
So I was talking earlier about addiction stigma, and it's really important to understand that stereotypes can lead to prejudices, can lead to discrimination. Any good employer does not want to have discrimination in their workplace. So we here at Shatterproof are addressing stigma at a variety of different levels. We spent quite a bit of time studying different stigma movements, and also really understanding what the key drivers of the overdose and opioid epidemic have been. And you can see here shame and isolation, individuals not seeking help for addiction, insufficient treatment capacity, criminalization, social structures and barriers. And so because of these pervasive stigma that's been happening, we said we need to really create a national plan to address this. And so we spent some time studying other stigma movements and created this national plan. And of course, if you create a plan, you want to measure if that plan is going to be successful. So we also created the Shatterproof Addiction Stigma Index. And what we found, and like I mentioned earlier, 75% of our country doesn't believe that substance use disorder is a disease. 51% believe that a substance use disorder is caused by bad character. 61% are unwilling to be a friend, a coworker, or neighbor. And then 78% are unwilling to have someone with substance use disorder marry into their family. We also found that self-stigma, so that's public stigma, but self-stigma is what an individual with substance use disorder feels. And so 33% are ashamed of themselves and 35% believe that they have bad character. We're also seeing that that there's healthcare stigma as well. And so we've been addressing that with 65% of healthcare workers don't believe that this is a chronic illness. We are taking steps to create curriculum to educate healthcare workers so that they can better serve people who may be struggling. You can go to the next slide. So our strategy really focuses on 6 sectors of society, employers being right there, communities at large, the entertainment and media area, government, the carceral system, healthcare. And what we found is that if you educate, change language, and change policies, you're able to reduce stigma. And so that's what our national plan is addressing. As Leslie mentioned, we do have lessons. We have an entire area on our website about how you can take action around stigma. Changing your language is one of the first things that you can be doing, and we have lessons in that, and a whole guidelines on just changing words. Like, for example, don't call someone an addict or use the word junkie. These are it's just stigmatizing language that creates that pervasive stigma that people who are struggling are facing. Next. Staying safe is really important these days. Harm reduction is probably a term that you're hearing. And because of the pervasive use of substances in this country with that 46 million people, it's important that we are helping people stay safe through a variety of ways. First, fentanyl. This new number of overdoses that's happening, 112,000, 80% of that is caused by fentanyl poisoning. And so it is just really important that we are thinking about how we're educating people about the dangers of fentanyl, because fentanyl is in everything these days. Every drug that's out there, fake pills that are being accessed online and through other sources. So it's really important that people really understand those dangers. And understand that there are ways to stay safe, whether that's using fentanyl, testing strips, how to spot an overdose. The former Surgeon General, Jerome Adams, once said, it is likely that you will use Narcan or naloxone to save a life these days versus CPR. Because of the amount of deaths that are happening from overdoses. And so it's important that people know how to spot an overdose and even, carry naloxone like they would mace or any other, protection that they can save a life with. And so we're, really active in helping people know how to do that. And with naloxone being available over the counter now, it makes it a lot easier for businesses to make that available for their employees. So again, these are things that you can learn through Shatterproof at our on our website that we've been offering. So a lot of times we hear from employers like, how do I find the right help? How do we help? And of course, there's health plans, and we know that. So we've been working to really look at the addiction treatment landscape and help transform it, because we know that healthcare costs are higher for those with SUD than without SUD. We know that people often don't know which type of care that they need. And we also know that the wide variety of care that's available, some of it's scientific based and some of it's not. And so Shatterproof prides itself on the fact that we have created the principles of care, which is a standard of care for addiction treatment, so that there's 8 areas of addiction treatment that people should be looking for when they're looking for quality treatment. And we worked on creating those with the best experts in the country. We then applied those standards to the treatment centers in our country. And so that led to us creating a platform to help individuals, their loved ones, and others navigate to quality treatment. So we offer a website called treatmentatlas.org. And it's a free and confidential website where people can take a quick assessment and just understand a little bit better about the type of treatment they might need. And they give some information, the type of substance they may be using, some of their lifestyle and demographic information. And then the website creates a list of quality treatment centers in the state that you live in. And we are rolling this website out across the country. We're now in 14 states and about 50% of the population having access to Treatment Atlas with these quality measures on the states that they're in. And this website is really to help individuals and their loved ones better navigate the treatment system. They can search by their insurance company, they can search by different demographics, and we help them kind of break through all of the misunderstanding that's out there. If you were to Google addiction treatment, which most people do, you'd see that the first 10 things that come up are sponsored ads from addiction treatment centers. It's hard to know if they're good, if they're bad, if they're quality, and what's right to look for. And we're trying to help our country better navigate through all of that to get to the right type of treatment that they might need. We also take that information and we provide it to payers so that they can make better choices about their reimbursements. And we also take the data that we're collecting from the providers and make sure that they see how they're measuring up against their peers. So with all of this work, we're hoping to transform that addiction treatment system. And so the website's really easy to use. It's intuitive. We worked with ASAM to create that assessment for individuals. And then the assessment is really easy, and it can individuals can find something that's very local to them or within their state or another state that we're in. And like I said, it's actually free and confidential. And we work with a lot of employers to make sure that they have this, because a lot of times people are uncomfortable, right? They don't want, even though the employers are there and may have the support systems they need, some people are uncomfortable going through, their insurer or others. And so we want to make this available to companies to be able to offer as a link on their website and their HR benefits in case people need help and they just don't have, or they have shame, or they're struggling with whether it's safe for them to go and look for treatment. So again, this is free and confidential, and it can be linked easily to your own, employee website. And so you can learn more about this again, at our employee resources site, where you can also see different things and learn different things about what good treatment is, those principles of care that I mentioned, what kind of medications are available and scientifically proven that can help people. And then, of course, the different things around paying for treatment, which is also confusing for people. So that brings us to the end. We have a lot of resources that are available. Like I said, we want to be that resource for employers, to be that trusted guide. And so, you're welcome to visit our website. We're happy to take any questions right now, answer any questions, or go deeper on any of the things that we shared. And we'll open it up now. You can use the chat or you can speak.
Kirsten, can you share just a little bit more about the process if a company wants to participate in this program or sign up for Shatterproof? What does that process look like? How does that pricing work? And what is sort of like the first 90-day implementation plan, so that employers know what to expect when they sign on?
Well, a lot of the things that we shared today are free on our website, but Shatterproof Just 5 is something that we do work closely with the employer, because we co-brand the site. So there is a fee for that. And then if we want to take it one step further, we actually will work with employers and partner with them to create a program, an annual program to make this safe to talk about in the workplace. So, for example, we're working with one company where this year, it's a multi-year partnership, where this year we're just introducing substance use disorder as a topic that they're addressing in their workplace. And so we're having town hall meetings, we're implementing Just 5, we're creating some customized education materials, and then we also have some employee engagement opportunities for them. Next year, we'll be taking that one step further with additional town hall discussions, additional education, and then also looking at how we are going to address culture change. some of the other work that we do also can look at measuring stigma within workplaces. As we know, not all workplaces are created equal and are different. And so we usually customize plans depending on what people are looking for. But that Just 5 program is available. I'll let Leslie talk about that, because if you're just interested in just enrolling in Just 5, that's available as well.
Just 5, again, is a very simple way to start on working and starting the conversation in your organization. So if you're not ready to really do the town halls or bring in stories from other employees, again, it's very simple, and the cost is very low for most employees. It's $5,000 to put the site up and co-brand and release it together. There is also a Spanish language version of the site that is available, which we can put up as well for your organization, which has been culturally translated. And again, it's very easy to start, and that as a first step.
Great, thank you. And I'll just say that the companies in the Health Action Alliance Network that I know that are using the Shatterproof programming have nothing but really glowing things to say about the impact in their workplaces. I'm reminded that several of your customers and clients, partners, participated as speakers in our webinar back in September, and signaled the really positive impact, both in terms of employee culture that was realized as a result of your partnership, but also to breaking the silence inside workplaces and fighting stigma. So just want to acknowledge again the outstanding work and the great services and support that you provide employers in HAA's network, and certainly the strong results that they're seeing as a result of their collaboration with you all.
Thank you. Great. Any other questions? If not, we can let you get on with your day. We thank you for taking the time to be with us today. And as you saw, shatterproof.org/employee resources is a place where you can go to learn more. Thank you.
Great. Thanks, everyone.